you so much for joining me today for our second video in our Asthma Awareness Month series. Today I have with me Dr. Kate Taylor, who is a clinical executive at Safer Care Texas and also assistant professor within the UNT Health Science Center Geriatrics Clinic. Thank you so much for joining me today, Kate.
Well, thanks for having me.
So in our Asthma Awareness Month series, we've already interviewed Kim, who described her experience with asthma and how she's able to manage and control it. And today we wanted to discuss how it is coming from a parent who has a child with asthma. So Kate, I know you have two adorable twin sons, and one of them has asthma. When was he diagnosed with asthma, and what signs was he showing for you to bring him to a pediatrician and realize that he has asthma?
So I probably knew that Cole had asthma when he had the flu when he was about 4 or 5 months old. Well, actually probably closer to 6 months. And he was at really high risk for having asthma because he was born prematurely.
Oh.
So he was spent 3 months in the NICU, was on a ventilator for a week, on the CPAP machine for a week. So he was born with premature lungs, and then we thought we were sort of over it, but then when the flu season came out, that fall or winter, he started having some wheezing and some shortness of breath when he had fever. So we took him to the emergency room, and we were hospitalized for about a week.
Oh my gosh.
Yeah, he didn't need any kind of ancillary support in terms of a breathing machine, but he did need some oxygen. And so from that point, that's when I knew he had asthma.
Okay. So while you were at the hospital with him, did they diagnose him with asthma there, or did you end up having to go to your pediatrician, and did they help you out with diagnosing him with asthma?
Well, after we left there, then we went to our pediatrician, and she recommended that we have an evaluation by a pulmonologist. So we went to Cook's and saw a pulmonologist there, and she did some tests and then diagnosed him with asthma. And then at that point, we went home, and there wasn't really any new medications that were introduced at that time. But then throughout the wintertime, he kept having some issues and needed steroids. So after a couple of rounds of steroids, and it was determined he probably should be on some inhaled steroids for a while. So we did that for a couple of years. And then he seemed to have less needs for steroids, and we were able to wean off the inhaled steroids. So at this point, we only use a rescue inhaler.
So since your son is at the age where he's in school, how do you work with the school and the school nurses to make sure that he has his rescue inhaler and his medication there, just in case there is an emergency?
Well, in the past, I have been in communication with the school nurse, but this past year, really, he hasn't needed his rescue inhaler, so I didn't have any rescue medication for him at the school, and they know that I'm really close by, so if there's any problems, they know to just give me a call, and I can run up to the school and see what's going on.
Okay. So have you had to go up to the school and help the school nurses out, or been there for him during, if there was an emergency or he has experienced severe symptoms?
I haven't, just because since he started school, his asthma has been well controlled. Since he was on the inhaled steroids, that really calmed things down, and he really didn't need much of a rescue inhaler use, except for a couple of times a year. So I haven't really had a need at the school.
Now, you mentioned he has to use his inhaler a couple of times a year. What time of year does this usually occur in? And then what is triggering these symptoms for him?
Sure. Well, definitely seasonal allergies. So in the fall or the spring, typically he may have an exacerbation or a worsening of his asthma. And then if he gets like a febrile illness or viral illness, then that may affect his lungs too. So I would say, 2 or 3 times a year, either seasonal allergies or a viral illness may cause them to have a flare up.
So, is your son old enough to manage his own asthma? And if so, what did you do to get him to this level? And what did you say to him to make sure that he understands exactly what's happening to his body and making sure he knows what to do in case of an emergency?
Well, I think we've just kept our communication open. Every time he's been sick and he's having a hard time breathing, we tell him why he has to use the nebulizer and the inhaler. And so he's sort of just known that verbiage from the very beginning. But now he knows, like, to say, "Hey, I'm whistling in my chest." So that's
Oh,
that's
okay.
that's the term he uses.
Okay.
Or he knows if his nose is sort of runny or his throat is scratchy, that he needs to take an antihistamine. And so he knows to say, "Oh, I got to go take my allergy medicine." He also knows that sometimes if his allergies are really bad, like at night, for sure, he would need to take a bath or a shower so he can get all those allergens off his body before he goes to sleep. So
Okay.
he knows how to manage those type of symptoms.
Well, I'm glad to know that he is able to manage his asthma and that it is under control and he does know what to do in case of an emergency. That's great. Now, for my last question, do you have any other recommendations for a parent that does have a child who has asthma or might think that their child has asthma, and then how to find a pediatrician if they don't have one?
Sure. I think the first thing is to know, if you're at increased risk for asthma. So if your prematurity can be a risk, if you have what they call atopic diseases. So if you have allergies, whether they're seasonal or to milk or certain food products, different environmental factors that can cause asthma, um, or if your parents smoke in the home or
Mhm.
you're around secondhand smoke, that would be an increased risk. If you have like skin diseases like eczema, that would put you at increased risk for asthma. So those are some things to know about. Obviously, being at risk is the first thing to know. The
Yeah.
second thing is to get to have care by a primary care provider or a pediatrician. And if you don't have a pediatrician, then um, really getting online or contacting your insurance to see what providers are available.
Mhm.
So sometimes it takes an active search of trying to find some medical assistance, and it just really is best to do it proactively versus reactively. So if you can get your medical care before there's a problem, is a lot better to manage than reactively after the fact, after you go to the ER. Because what you want to do is try to prevent going to the ER at all possible costs.
Well, thank you so much, Kate, for sharing your story. We really appreciate that and celebrating Asthma Awareness Month with us. And remember, if you have any questions or need additional information about asthma or even asthma related to COVID-19, you can visit our website at www.asthma4on1.org or also follow us on Facebook at Asthma 4on1 and at Safer Care Texas. We hope everyone stays safe and healthy, and we hope you have a great week.